Hello and welcome. Today we're going to discuss a rare and devastating genetic disorder that significantly affects the eyes, among other organs, Tay-Sachs disease, specifically focusing on the characteristic cherry red spot seen on the retina. This condition can have a profound impact on individuals and families, and understanding it is crucial for awareness and potential future advancements. Tay-Sachs disease is caused by a mutation in the hexa gene. This gene provides instructions for making a vital enzyme called beta-hexosaminidase A. This enzyme's job is to break down a fatty substance called GM2 ganglioside in the brain and nerve cells. When the HECA gene is mutated, the body can't produce enough functional beta-hexosaminidase A. This deficiency leads to the accumulation of GM2 ganglioside to toxic levels, primarily in nerve cells. The pathophysiology of Tay-Sachs revolves around this buildup of GM2 ganglioside. These fatty deposits probably damage nerve cells in the brain and spinal cord. The retina, being an extension of the brain, is also affected. The cherry red spot arises because the ganglion cells in the macula, the central part of the retina responsible for sharp, detailed vision, are relatively spared compared to the surrounding retinal cells, which accumulate GM2 ganglioside. This accumulation creates a contrast, with the healthier macula appearing as a bright red spot against the background of the lipid-laden, paler retina. This phenomenon is not unique to Tay-Sachs, but it is particularly associated with it, and related GM2 gangliosidosis. Tay-Sachs disease is a rare autosomal recessive genetic disorder. This means that both parents must be carriers of the mutated HEXA gene for their child to inherit the disease. It's most prevalent in certain populations, particularly those of Ashkenazi Jewish descent, French-Canadian communities in eastern Quebec, and certain Amish communities. Carrier screening programs in these populations have helped to reduce the incidence of the disease. The signs and symptoms of Tay-Sachs disease vary depending on the type, but generally appear in infancy for the most severe form. Initially, infants may appear normal, but around 3 to 6 months of age, developmental milestones start to slow down and eventually regress. Muscle weakness, exaggerated startle response to loud noises, difficulty sitting or rolling over, and progressive loss of vision are common. The cherry red spot on the retina is a key diagnostic finding. Seizures, feeding difficulties, and progressive mental deterioration follow, leading to significant disability. Diagnosis typically involves a combination of clinical examination, including an eye exam to identify the cherry red spot, and laboratory testing. Enzyme assays can measure the level of beta-hexosaminidase A activity in blood or skin cells. Genetic testing can also confirm the presence of mutations in the hexa gene. Prenatal testing, such as chorionic villus sampling or amniocentesis, can be performed to determine if a fetus is affected if both parents are known carriers. Tay-Sachs disease is broadly classified into infantile, juvenile, and late-onset forms based on the age of onset and the severity of symptoms. Infantile Tay-Sachs is the most common and severe form, with symptoms appearing in infancy. Juvenile Tay-Sachs has a later onset, typically in childhood, and progresses more slowly. Late-onset Tay-Sachs, also known as adult-onset Tay-Sachs, has the mildest symptoms, which may include muscle weakness, tremors, and psychiatric problems, appearing in adulthood. Unfortunately, there is currently no cure for Tay-Sachs disease. Treatment focuses on managing symptoms and providing supportive care. This may include nutritional support, respiratory care, physical therapy, and medication to control seizures. Palliative care is essential to ensure comfort and quality of life for affected individuals and their families. Prevention primarily involves genetic screening of individuals, especially those in high-risk populations, to identify carriers of the hexa gene mutation. If both partners are carriers, they can consider options such as preimplantation genetic diagnosis, a PGD, during in vitro fertilization, or prenatal testing to determine if the fetus is affected. Genetic counseling is crucial to provide information about the risks and options available. The prognosis for infantile Tay-Sachs disease is very poor. Children with this form typically do not survive beyond early childhood, usually dying by the age of 4 or 5, due to respiratory infections or other complications. Juvenile Tay-Sachs has a slightly longer life expectancy, but the disease is still progressive and debilitating. Individuals with late-onset Tay-Sachs may have a normal life expectancy, but can experience significant neurological and psychiatric problems. Recent research is exploring gene therapy and enzyme replacement therapy as potential future treatments for Tay-Sachs disease. These approaches aim to correct the underlying genetic defect or provide the missing enzyme, but are still in early stages of development.